Let's go ahead and get started. On behalf of King County and the Wilson Sheehan Lab for Economic Opportunities at Notre Dame, I want to give everybody a big welcome to our Evidence Matters series. It's great to see so many friends and colleagues here joining us. We are recording this webinar. We are going to air it at a later date on King County Television here in the Seattle region. So I want to welcome everybody who's joining us on that platform as well. I'm Carrie Chihawk. I'm King County's Evidence and Impact Officer, and I'm really passionate about advancing racial equity through bringing together the expertise of our staff, our research partners, and most importantly, our community. And our intent with this Evidence Matters series is threefold. First, we want to share the knowledge we're building from our learning partnerships so we can use that knowledge to advance better and more equitable outcomes in our communities. Secondly, we want to celebrate successes related to our work. We'll share some of those here today. And we also want to share our challenges. And then third, we want to build connection with all of you tuning in locally as well as from around the country and learn from each other. So today, I'm really pleased to be serving as host for this fantastic conversation on the current state of childcare in the United States, and as well the innovative work that's being done in local communities to create a really thriving sector, and a sector that equitably values children, families, and workers. I think often childcare workers sort of get left out of that conversation, so it's really important that we bring them into that. Each of you attending the webinar live is a valuable part of our conversation here today, and we're going to reserve time for your questions at the end. So if you're joining the webinar live, at the bottom of the screen, you should see the chat function, and you can type your questions in there at any time during the webinar. The host, moderator, and panelists will see those questions, and then we'll direct your questions to the panel at the end of the conversation. So I want to go ahead and introduce you to the outstanding partners we have joining us here today who are going to share their learnings and experience. These are folks who are working on solutions to childcare at all levels, from national research on early childhood to advocating and funding for home-based childcare, to local government programs in King County, and to advising jurisdictions across the country on the needs of childcare workers. So let me introduce you to them. So first we have Chloe Gibbs. She's joining us from the University of Notre Dame, where she's assistant professor of economics. Chloe's research includes analyzing the impact of full-day kindergarten on how kids develop, looking at how Head Start impacts outcomes for both children and their parents, and looking at how impacts of early childhood last as children grow older. We're really fortunate to have her here. For the last year, Chloe served as a senior economist on the President's Council of Economic Advisors for the White House. And you can get a sense of her work by checking out the chapter in the economic report of the president that she authored, which really takes an in-depth look at childcare. Great to have you here, Chloe. We also have Jessica Tolliner-Cafferty, and she's joining us as my colleague here in King County government based in the Seattle region. And Jessica recently became our co-lead for Best Starts for Kids. And she served for several years as King County's child care policy lead. So really brings a depth of experience into this conversation. As co-lead for Best Starts for Kids, Jessica is advancing a King County evidence-formed initiative to support every baby born and child raised in King County through comprehensive support from prenatal development to adulthood. And Jessica brings a really strong racial equity lens into that work. So thank you, Jessica. And then our final panelist is Justin Dormal. He joins us from the Urban Institute in Washington, D.C., the other Washington, as we like to call it. The Urban Institute is a nonprofit research organization that provides data and evidence to help advance upward mobility and equity. And Justin's research focuses on policy initiatives to stabilize, build, and strengthen the availability of high-quality early care and education. So he's been working with jurisdictions around the country on ways to go about doing that. And finally, I'm very excited to welcome our moderator to this conversation. Alexandra Patterson serves as the Director of Policy and Strategy at Homegrown. And Homegrown is a national collaborative of funders who are committed to improving the quality of and access to home-based childcare. And at Homegrown, Alexandra's work focuses on the policy solutions that really value kids, families, and workers in those home-based childcare settings. So she's a perfect moderator for this conversation. She has a depth of experience over the last 15 years. She's worked in the early learning sector in a wide variety of roles, from an actual Head Start teacher. So thank you for that, Alexandra, to being intermediary director for Philadelphia's pre-K program. We've got a lot of great partners here in the audience. Again, I really encourage you to pop your questions into the chat. You can also pop a little bit about who you are and where you're coming from into the chat. We'd love to see that. And with that, I will turn it over to Alexandra.
Thank you for that introduction, Carrie. Before turning to our panel, let's just take a quick moment to set the stage for the discussion. So we have years of brain science that tells us that over 90% of a person's brain develops in the first 5 years of life, and more than 1 million new neural connections form in a child's brain every second. But in the US, we leave the business of childcare really for families to figure out and to largely cover the cost of. We don't treat childcare as a public good that undergirds the American economy. And so families in the US rely on a range of childcare options. Some of those are formal licensed childcare arrangements, and others, families select informal regulation exempt childcare. The National Survey on ECE informs us that childcare takes place in a broad range of settings, from large childcare centers to small home-based childcare to care with family, friends, and neighbors. So today, we will be talking about childcare broadly and how we can work toward building an affordable, accessible, quality childcare system that meets the needs of families and children and that values the essential contribution of the childcare workforce. So I want to start with Chloe. Chloe, you've spent your career studying the evidence behind early childhood learning programs and their long-lasting benefits to children and society. Can you talk with us briefly about what the evidence shows about why childcare is so important?
Of course, I'd be happy to do so. So there is a large and growing as we speak, body of evidence that demonstrates how high quality early care and education experiences. And I use that umbrella term to include childcare, Head Start, other types of preschool programs, that sort of myriad landscape that Alexandra described of where kids are spending their time when they're in their early years. And so we have this body of evidence demonstrating that those settings and experiences can produce important benefits for children and families, including facilitating parents' employment, and particularly a large body of evidence that suggests that mothers' employment is very responsive to the availability and the price of early care and education. Also improving children's school readiness and their early social and emotional skill development, and increasing children's long-term outcomes, such as how far they go in school, their executive function, their own employment, and subsequent earnings. And so we know from this body of research how important early care and education is as a support for working families. Just a few statistics that really, I think, drive that point. More than half of U.S. workers have care responsibilities outside of their full-time jobs. And the share of young children that are living in households where all parents in the household are working has grown and is now over 60% of families. And that's driven in part by women's increasing labor force participation in the 1970s through 1990s. But we do know also from the National Survey of Early Care and Education that 60% of children under age 6 who are not yet in kindergarten are in some form of regular, that is weekly, non-parental care. And we also know from the research that quality of those experiences matters. And so I think we should really think We should take this whole research base to suggest that investments in children and in working families really are investments in our country's productivity and economic flourishing.
Thank you, Chloe. I'd love for us to dive just a little bit deeper and to talk a little bit about the childcare crisis. I think we all are seeing the headlines that continue to persist even post-pandemic about the difficulty that families have in finding care, and when they find care, the difficulty that they have in affording care. And so I want to turn to you, Jessica, and ask you a little bit about the Seattle area. What challenges are you seeing when it comes to childcare, and how does that impact families and the people who work in childcare?
Yeah, thanks, Alexandra. I think, what we're seeing in the Seattle area is not different from what folks are seeing across the country. The challenges are really similar, right? What we're seeing is the result of a broken market where families have trouble accessing care. When they can find care that meets their needs, they often have trouble affording it. And even if families are paying the full cost that they're charged, that market rate, those market rates aren't actually covering the true cost of care, so that the people delivering that work, the people caring for children and educating our youngest children, are able to make thriving wages. And so the impact is really significant, right? It means that families not only don't necessarily have access to the care that allows them to do things like go to work, right? Go to medical appointments, be present in their community, take care of themselves. But it also means that we're potentially losing out on a significant protective factor for young kids, something that can be incredibly meaningful and positive in their early life. The low wages are also exceptionally low. In Washington state, a recent study found that they were in the 3rd percentile of occupational wages. So that means 97% of our occupations in Washington state earn more than those folks who are caring for, nurturing, and educating our youngest children. And that really does drive both high turnover and instability in the sector. And so what we have then is a negative impact on kiddos, on families, on the workers themselves. And I would argue, to Chloe's point, on our economy and on our communities, right? That this is actually an integral part. I think the one thing I want to call attention to that we see in King County in particular, but is true across the country, is that this is directly tied to a legacy of racism and legacies of sexism, and caregiving typically being women's work and women of color's work in particular. There are direct ties in the childcare field to the history of enslavement of Black women. And it is really critical that if we're committed to justice, if we're committed to racial equity, which is certainly a critical part of our focus at King County, that we're not only saying how do we stabilize the field, but also how do we repair these things? How do we rectify these things? And how do we build and support a thriving and valued workforce and a sector that is really able to meet families' needs?
Thank you, Jessica. Justin, does that view of the challenges that we heard Jessica describe in the King County area resonate with what you're seeing around the country?
Yeah, thanks for your question. And thanks, Jessica, for setting that up so nicely. Yeah, a lot of the challenges Jessica raised are certainly not unique to Seattle. As she mentioned, we see these issues a lot throughout the country. Of course, how acutely states and localities are experiencing issues of low wages and turnover will likely vary, but I think a lot of places are experiencing this. But I think one thing that Jessica hit on really well is that, for those places where this problem is especially acute, it's clear that there's really something about the childcare market that is fundamentally not working, especially the financing around it. And so I think Alexandra mentioned at the beginning, sort of like we've been seeing it in headlines over and over again. And so it's very clear that this is a problem that's sort of pervasive, and wanting to mention that even though a lot of that attention has certainly come about post and during the pandemic, it has been an issue that has pervaded this country for many, many years now. And it's really hard when we think about sort of, just those issues, right? Thinking about sort of how hard it is to run a childcare business, just during thinking about sort of the staffing and recruitment challenges that providers are facing. And as Jessica said, it ends up being an issue about access as well. One thing I want to mention is that it ends up being this sort of issue where access and staff and compensation staffing are sort of interrelated, right? And so research has shown this idea that, like, on the one hand, it's really hard. Providers are having a really hard time finding and keeping workers at a thriving wage unless they are able to sort of be able to afford those wages. And often that comes from revenues from providers, but we also can't ask families to pay more than we already know they're paying a lot for. And so they're challenged on that hand. But the other hand, because of staff-child ratios, they can only increase enrollment until they have more staff to teach and care for those new children. And so it's this really double-sided issue. And so without some sort of way to make that calculus work, what ends up happening is providers often find themselves sort of faced with financial precarious situations, oftentimes taking their own wages as a result to make things work. And we know that that can have implications for the quality of care that they're giving providers when day to day they're wondering how else they can sort of, return home, be able to sort of continue with their lives outside of their work environment as well. And I think one last thing I want to mention is that compensation issues and turnover in childcare is that this is in some ways self-reinforcing, unfortunately, where, without, childcare businesses are sort of hiring new workers, but without the right wages and working conditions, what ends up happening is that they're just driven out all over again, only for the process to repeat itself. And so Jessica mentioned negative outcomes for workers, families, and children. And if you think about sort of what it means for a site director to sort of have to constantly focus on hiring over and over again, it really takes the responsibilities away from other things that are important for childcare quality, and can have sort of a compounding outcomes as well for their just the operations of childcare and what it means to provide high quality care.
Thank you, Justin. Chloe, as an economist, how do you see this at the national level? What are the challenges that motivate public sector intervention? And what are the consequences for all of us for allowing the crisis in childcare to worsen?
So I am going to echo a lot of the same themes because as Jessica and Justin both laid out, these challenges are pervasive across the country. And I'll just sort of touch on what exactly are the economics of the early care and education market that result in these challenges that we're focused on. I will say, just as sort of foundation for this, that I mentioned 60% of young children are in some type of non-parental care on a regular basis, and I'll just mention that number lags most of our peer countries in terms of participation, and also that there are gaps by socioeconomic status, by race, ethnicity in what that participation looks like. And so what leads to what I think we can call under provision of high quality early care, under participation in high quality early care. So these challenges sort of result in what everyone is describing as a gap between the cost of providing high quality care and the price or prices that families can afford. And we actually just did, on my way out the door at the Council of Economic Advisors, a blog post that was posted on Monday of this week on affordability constraints and what that looks like for families across the income distribution, sort of putting in one place a lot of the analysis that we did over the last year to inform our policy efforts. And I'll point out sort of, I think, two things that jumped out at me from that analysis are that access and affordability challenges are really prevalent for all families that are seeking childcare. They are much more pronounced. The constraints are much higher, and the access issues and affordability issues are much more pronounced for lower income families. So these two facts really point to both, as economists would think about it, efficiency concerns and distributional concerns, and suggest that investing in this market to address this gap between costs and prices that families face would actually make the market more efficient and more equitable. And so these challenges, I think Jessica, Justin have laid them out, but they, so first and foremost, paramount in this discussion are the workforce challenges. That this is an industry characterized by low pay, extremely low pay, and by high turnover, which then has implications certainly for the quality of care, especially given what we know from research about the importance of those interactions between caregivers and children, and the stability and continuity of that relationship. So workforce challenges are very paramount. That it is costly to provide high quality care because it is a labor intensive industry, right? We cannot sort of move to automation or technology to provide this kind of human interactions that undergird this these experiences. And so providers have very few options for increasing revenue because they are relying on parents' payments predominantly. And the main input to what they're providing is their staffing. The pricing then, is another sort of key piece of this, that price sensitive customers may forego care. They may decide that they're not going to work and stay home with children because of the high cost of care, or they may opt for less regular or less sustainable options to sort of fill in for care when needed. And those sorts of settings might not be as of high quality as compared to the more stable arrangements that families could seek. And then finally, this is an industry that is characterized by a lot of sole proprietorships. And it is a very fragile business model, as we saw in the pandemic when these businesses are very subject to economic headwinds. So when there is a recession, they are particularly hard hit. We've seen that the workforce in childcare has not rebounded to pre-pandemic levels as the rest of the workforce has. They're subject to startup costs and very low margins. And so that means that it is a fragile business model without, in the absence of public investment to ensure that stability. And I'll just point out that all of these challenges, they not only affect families and children who would be in care, but also women's careers, and that has effects on labor supply more broadly that sort of ripple throughout the economy, has implications for our overall economic productivity and growth.
Thank you, Chloe, for really putting a finer point for us on the intersectionality of the economic impact. I want to now dig a little deeper here and talk with Jessica. Let's loop back to Jessica and talk about some solutions. Really been a pleasure to work closely with the King County team as they've piloted a number of programs to really respond to this range of needs facing both families and also the childcare workforce. So I want to loop back to you, Jessica, to focus on a few of the solutions that you all have been piloting.
Thanks, Alexandra. I want to use the word solutions loosely, because I think what we're doing is taking really big steps forward towards a long-term vision and recognizing that what we have done so far is both sort of historic and an incredible opportunity that is the result of really brilliant leadership and community by providers, by families, and a moment of political will, and that it is so far from where we need to get to have a really thriving system, a really equitable and holistic system. And so I think, we sit in sort of an interesting spot. Our county holds the city of Seattle, which means that we have access to more resourcing than many communities do. And so recognizing that we have money to work with there and to try things and to take risks and be innovative in how we do those things in a way that not all jurisdictions are able to do. That being said, as part of the Best Starts for Kids levy during renewal, voters did approve a pretty significant increase that included about $200 million in childcare funding over 6 years. And so we're doing a couple of things with that, trying to really think about how we can be responsive to what we've heard from providers, from families, and from community, where we hear a resounding cry to invest in this sector and to think about how we can do so driven by people who are either working in this sector or accessing it on a daily basis. And so what we've done are a couple things right now. We've done, we've launched a childcare subsidy program that builds on top of our statewide system. We have a pretty big statewide system that serves families who are predominantly lower income. In King County, the cost of living is so high and our salaries are increased, and families still live in a space where they earn too much for eligibility for these subsidies, as well as for many other public programs, and truly can't afford the full cost of care or even the market rate that's being charged. And so we came in and developed a subsidy program that serves families living in King County and provides financial assistance on a sliding scale for families who are ineligible for that statewide program. What's been really interesting is that we serve a number of families who live in this space sort of just above income eligibility, but we also serve a lot of families who are actually income eligible for statewide subsidies, but ineligible for other reasons. And I think that's one of the places that the county has the flexibility to try new things, right? To model where things may work, where they may not. One of the things, for example, that we've done is we removed activity requirements for families. When we sort of held this belief and value that was really clear to us that care should be accessible for any family who needs it, right? That any family and any child should be able to access care, and we shouldn't be deciding who is sort of meeting requirements or not. It became really clear to us that we had an opportunity to test that. And so we've ended up serving a lot of families who might not meet specific requirements of sort of longer lasting programs. And we're really eager to learn about how that impacts the stability of those families and of the childcare sites and caregivers who serve them. We're also in the process of getting ready to launch a wage boost pilot. That's a pilot that will look at how we can increase wages of childcare workers, of the individuals providing care in licensed settings over the next 4.5 years, and what that impact will be on the sector. We have some really promising evidence already in this arena. I think one of the things we're really excited about there is that we're also going to be engaging providers and really understanding what their idea of success is. So what are the measures that would be meaningful to them in understanding whether a wage boost really made an impact? And Justin and the team at Urban have been phenomenal partners in helping us think about how we create a pilot program that includes evaluation that is responsive to and respectful of the folks that we're engaging. The last thing I'll just say is that we're also really thinking intentionally about informal care. This is a huge part of the sector that often gets left out of the conversation. And we recognize that it is both a critical part of the sector and often the first choice for many families. And so we've really appreciated the partnership of Homegrown in particular in helping us think about and continuing to think about how we can be effective partners and supports for informal caregivers, family, friend, and neighbor caregivers, and the families who choose that type of care. So lots of work left to do. We are nowhere near the end goal, but I think really exciting to be in a position where we can contribute to that conversation and hopefully be contributing evidence to provider-led movements and family-led movements to really increase support for this field.
Thank you, Jessica. I really love that you underscore the role of provider voice and the role of family voice in crafting that vision and crafting the action steps for that vision. That's really a value that Homegrown also holds. Chloe, I want to go back to you and give you an opportunity to talk about solutions that are worth highlighting in response to the childcare crisis.
Great. So I will again echo a lot of what Jessica was talking about at the local level in terms of thinking about what kinds of comprehensive solutions could work nationally to really sort of fix exactly the challenges I talked about in the market writ large. So I think that there are really a couple key features of solutions that could take a variety of forms around these features. And so I think a lot of us are familiar with the types of programs that provide subsidies to families. And Jessica talked about some innovation on that front. One of the things that we discovered in our analysis of the data on affordability is that there actually is sort of a peak in the challenge of finding care, and specifically challenges finding care due to cost for families that are just above sort of where often eligibility thresholds fall for accessing subsidized programs or for receiving childcare subsidies. So there is a particular pain point that is concentrated among those families. So I think thinking more sort of comprehensively and generously about where we provide subsidies and how we think about that. I mean, it really is just a fact that that childcare constitutes a large share of family income, really for many families, not just a problem that is concentrated among the lowest income families. And so that's one piece of it, is ensuring that subsidies for families or subsidized care for families is more accessible and really is attuned to the issue of how inaccessible and unaffordable childcare is for families right now. But there is another key feature here that I really want to emphasize, which is about the supply of childcare, and that we cannot just focus on families and their access to childcare without ensuring that the supply of high quality childcare exists. And so we need to invest on that side as well and subsidize the provision of high quality childcare with a real focus on the workforce, because that is where a lot of the challenges in this market stem from the fact that it is not a workforce that we have invested in, and therefore is not stable, is not well paid. And so I really think of this, of the solutions that could get traction on these problems as being subsidies on both sides of the market that incentivize both the supply of high quality care, particularly through investments in the workforce, but also support parents and families in seeking out the high quality care that meets their needs. And I also just want to emphasize in this conversation, since we are focused on what's happening in localities and in states, and also what the national perspective is that I really see an important sort of feedback loop amongst all of these entities that are working on this challenge. But I want to emphasize that states and localities have been very innovative and proactive in addressing these challenges, and we have a lot to learn from the successful work that they've done. That it's important, it feeds into the work the federal government has been doing and is ongoing, but it is insufficient to address these market challenges because they exist across geography, they exist across the sort of myriad landscape of programs and services that we've talked about. And so we really need comprehensive solutions that operate to fill in the gaps we see nationwide, to support these innovative efforts that are happening all across the country, but to really, redress these challenges, to really support the high functioning market that actually leads to the kind of provision and participation that we would like to see among families with young children.
Thank you, Chloe. I want to just underscore the role of states and local communities, particularly in this moment where we find at the federal level, a diverging set of priorities and really, recommended solutions from between the executive branch and Congress. And so, with those two, bodies of government being on a different page, really states and local governments have really sort of stepped up and looked for additional resources in their purview and looked for ways to mobilize solutions that could respond to the needs of families in their community. And so maybe, Justin, you're working at both state and local level. You could talk a little bit more about some of those solutions that you've seen state and local governments incorporating.
Sure. So for local, Jessica covered a lot of things. I'll focus a little bit on the state perspective first. Because I'm based in DC, I'd be remiss if I didn't mention what DC is doing, in addition to a number of revisions to the childcare subsidy system, both on sort of family co-payments and provider reimbursements. There's an initiative going on in DC called the Pay Equity Fund, which starting in 2002 allowed educators in licensed childcare facilities to receive essentially an increased compensation totaling up to $14,000 per year. For lead teachers, for assistant teachers was $10,000. Initially, this was sort of a more one-time payment situation, but then as the years went on, they were able to move it first to a quarterly payment system, and then eventually starting this October in fiscal year 24, they're going to be able to, they've set it up so that childcare providers can sort of apply for funding and implement minimum salary schedules directly at their sites, so that they're able to then provide the additional hourly wages to the teachers at their site. DC, of course, is very specific and unique in the sense that, you know, it's a very specific constituency, political base. There's sort of a will there that is maybe difficult elsewhere in the country. And so certainly there's a lot of interesting things going on in DC, but it may be difficult to sort of have elsewhere. I also want to mention other examples. And so in Virginia, there's been even before the pandemic, they have also tried to address the compensation issue. There's been what they initially piloted, what was originally called the Teacher Recognition Program, which is now has a different name, but they also tried to increase wages to educators. In that situation as well, there was direct payments. Initially, it was a $1,500 stipend to teachers so long as they were able to stay at their childcare sites. Over time, the scope and as well as the amounts has increased. And so now the program is statewide and also serves most publicly funded sites in Virginia. And so I think actually this upcoming year, 23-24, the goal is to be able to cover as all educators who are eligible across the state. One thing I want to mention as well, I think Chloe mentioned the idea of sort of having it sort of, you know, subsidies on both sides of the market. And so I think a lot of the examples I've talked about, especially in Virginia's, the initial part of Virginia, in some sense, it feels a little bit of a side solution in the sense that, you know, you're getting payments directly to teachers. You're not necessarily addressing some of the root issues. I know there's a lot of logistical challenges, and it takes time to implement a solution that, you know, addresses the fact that many child providers are independent. It's hard to work through individual payrolls to really think about compensation at sites. Virginia has sort of taken a two-sided approach where in the short term, they have this program and they're trying to sort of keep it for as long as it's needed to address compensation in the short term. At the same time, they've joined several other states to think about how they design reimbursements through subsidies, and in particular, as they're creating their cost modeling approach. One particular cost that they've really focused on is ensuring that all sites have sufficient funding to compensate teachers. And with this idea that you know, for you know, when we think about sort of like what does it take to provide care for high quality care for kids, teachers are really the main driver of childcare quality, and that wages are an important part of those costs. And so that's sort of going on in process, and hopefully sort of as, you know, the years go on, there can be sort of this more long-term shift and not having to rely on sort of programs that provide payments on the side to something that maybe is financing childcare in a different way.
Thank you, Justin. Jessica, you've been involved for several years as King County's childcare lead and are now the co-lead of Best Start for Kids. Tell us about Best Start for Kids and the new investment King County is making to address gaps in childcare.
Yeah, so I have the deep privilege of getting to be one of the two co-leads alongside Jamelia Jones, who I think is here today also for Best Starts for Kids. Best Starts for Kids is a pretty incredible initiative. And so essentially what we do is we partner with community-based organizations and really invest in programs, services, resources, policy change focused on primarily kids and young people. So thinking about the spectrum all the way from prenatal care and services to age 24. One of the things that I think is really exciting is that we recognize in government so often we're focusing downstream because there is an immediate and urgent need there. And that's really critical, right? When families and communities experience challenges, we have to address those and provide services and solutions. And we also believe that there is a really important priority to move upstream also. And so Best Starts is really focused on promotion of the good. So really, what do we do from an early stage to promote all of the good things, protective factors, you know, healthy attachment, all of these things that we know are good for kids and families. Prevention. So how do we prevent the bad before it even happens? early intervention. So when kids and families need support, making sure that we get it to them early in a way that meets their needs, in a way that feels supportive to them. And then policy change, right? We have this incredible opportunity and moment of political will and resourcing here. And we recognize that these are widespread issues. And so how do we really think about the ripple effect of how we can do this work and then influence policy change far beyond the county to really work towards these visions of what we call happy, healthy, safe, and thriving communities. And so it's a pretty incredible initiative to be a part of. Right now, we're in the second iteration. It's a 6-year levy. And so we renewed in August of 2021. Our second iteration of the levy began in January of 2022. And this iteration is nearly $1 billion of funding that we are distributing in partnership with community to do some really incredible work. As I mentioned earlier, about $200 million of that is earmarked for childcare. We heard loud and clear over the past 6 years that this was a major need for families and community, and that it touched every other part of our programming. And so when families thought about any of the services that they might want to interact with, childcare was a critical piece that might help them or prevent them from being able to access those things. Similarly, we found it touches so many of the county's other priorities, right? If you don't have access to childcare, it's really difficult to get to work if that's what you need to do, which means it can be really difficult to maintain stable housing. And that's a huge priority and issue in King County. And so really we're trying to think about how we move upstream to create I think investments and philosophy and action in a place that really supports the most positive outcomes for kids, families, and the communities that exist within King County and beyond, so that hopefully we don't get to that place of needing those sort of downstream interventions, even though we know in the interim we've really got to take those parallel paths.
Thank you, Jessica. Chloe, what excites you about the work that King County and other local governments are doing, particularly from an economic perspective? We heard Jessica talk about the intersectionality, thinking about housing, thinking about childcare, thinking about this range of intersections that impact families and communities. What's promising there?
So I think there's a lot that's promising there. And I think what excites me the most is that I think we have across the country these laboratories that are being innovative, trying new things, particularly in the space about investing in the workforce, and building the supply of high quality childcare so that the slots are out there for families to use and rely on. And so what I'm excited about in particular is that this presents many opportunities for us to look at the effectiveness of these different interventions and to look at exactly the range of outcomes that you mentioned when talking about the intersectionality of childcare with sort of all aspects of a family's life and well-being. So, we've often thought in the research about direct child outcomes, which are certainly important, about parental employment outcomes, again, a critical piece of this. But you can imagine other outcomes of interest when we invest in childcare. We can look at to see sort of the broad range of effects that these programs have. And I think that it is this evidence base that has been really critical to making the case for investments in early care and education, to continue to build momentum behind that case. And I think we've learned, as I sort of summarized very quickly at the top of the webinar, we've learned that early care and education can have important, meaningful effects on children, their families, their communities, the economy. And now we need to build out the evidence on understanding what works specifically in effective programs, what works for the workforce, for whom, for which children, what sorts of features of a program are particularly important to invest in, are impactful in what contexts. And so there's a whole set of research questions that could inform our policymaking going forward that I think are sort of ripe for study as places continue to innovate in places like King County and all across the country. And so, that I think is holds a lot of promise, not just for understanding how effective a particular program is in a particular place, but for really understanding what works and could translate to other settings, could be used in other places. I will also say that it really is about a body of research that can help inform those kinds of questions and policy decisions and features. I think that, often we have this big body of research about early care and education. And there are some instances in that body of literature where a program was not as impactful on a particular outcome as other iterations of that program or that program in other places. And sometimes that makes people, I think, a little bit uncomfortable, the sort of varied results in the evidence base. But I will say that is, as a researcher, that's exactly what we would expect to see, that not everything works, in exactly the same way in all places. And it's actually that body of research that can show us what works where, with what kids and what settings and that sort of thing, that helps us really tease out the critical features of policy. And so we should be comfortable with that variability, and we should in fact learn from it. And that is how we get to better policy and better programs.
Thank you, Chloe. Jessica, I want to make a connection here between Chloe's comments about the evidence base and really taking the opportunity with implementation to also be implementing, evaluation approaches that help us understand what is working in our communities and what can we continue to fine tune. And I think in particular, one thing that's really unique about King County's approach is that you all are doing both. You all are implementing, but you're also attending to that collection of evidence base. And maybe there's just a comment or two that you want to make about that. I think that would be really important to highlight for other communities as they're thinking about new programs.
Yeah, I appreciate that. I think evaluation is always a really important priority to us. And it's also one we hold with a lot of care, because we know that evaluation, when handled in a way that isn't really thoughtful and isn't handled in a way that is driven by relationship, can cause harm to the communities that we want to be supporting, right? That we want to be creating programs that serve well. And so I think we have had many, many, many conversations about how to do that well and continue to be in calibration. We've been really fortunate to have Carrie on our team to work closely with Urban, to have some really incredible conversations with the Office of Evaluation Sciences, and to get really clear on the type of evaluation we want to do that is both collecting a body of evidence that can be compelling, that can be taken seriously, right? That can tell a story that could translate to other projects in other places, but also that is driven specifically by the folks that are participating. So for example, with the wage boost, we don't want to implement an evaluation that isn't in alignment with what they want to see, or that's gathering measures that aren't reflective of what they believe to be successful. And so really centering providers all the time, or for our subsidy work, centering both providers and families all the time in that work. And what I think is really exciting is that there is this growing body of research, of evaluation strategies, of partners who are excited to think about creative mechanisms for how we can tell those stories in a way that honors and values the experiences of the people that they center on.
Thank you, Jessica. I want to loop back now to Chloe. I'm wondering if there's more that you want to say about the approach at the federal level, in particular around this notion that evidence matters. How is evidence helping to shape federal policy direction? You are working with the President's Council of Economic Advisors. What are you seeing in terms of the connection between evidence and the federal policy direction?
So it's, I think, an important question, and one we should hold our elected leaders accountable to thinking about. I will say that I do not speak for the administration. I'll speak sort of as having been there for the past year in the ways that I saw evidence being used and the importance of evidence in those policy conversations. And I'll just highlight, I think, a few of the things that that the president has done and the administration has done to really advance an agenda that is focused on families broadly and thinking about all of the challenges that families face. And really sort of investing in families and investing in children, because that is certainly sort of, that has ramifications throughout our communities, for the economy, for the future. And so, the president launched several executive orders on day one of the administration with a focus towards advancing racial equity, and a focus on using evidence in policymaking. And so those pillars are sort of prevalent throughout, I think, the administration's agenda. On childcare, we, as you pointed out, Alexandra, we are in a position where federal movement is going to be challenging on this front. The president put forth a budget for fiscal year 24 that was very robust in investing in children and families, with a big investment, a historic investment proposed for childcare, universal preschool, and other things that are very sort of related and intersect with this conversation, like paid parental leave. So that is the president's budget and what it signals about the priority that this is. In the absence of being able to make movement on those provisions in Build Back Better, the administration did get increases for all of the early childhood oriented programs in both Department of Ed and HHS. In the fiscal year 23 appropriations process. Soon thereafter, there was an executive order focused on the care workforce, both in thinking about early childhood, but also in thinking about disabled and aging people who interact with care systems in various forms, and home and family caregivers who are also vital to our workforce, our economy. And so there have been sort of these investments throughout. Last week, the administration announced a notice of proposed rulemaking for the Childcare and Development Fund. So this is the federal government subsidy program, as I'm sure everyone knows, but some modifications to the program to increase access, affordability, and stability of the workforce, and of providers, some of the critical challenges we've talked about today. I encourage people who work in this space to comment on that proposed rule, so that it is the best rule that it can be. And these are the efforts that you will see the administration engaging in to improve access, to improve affordability, to improve quality, with an eye towards attention to both the supply side and providers, who are the critical sort of foundation for the American workforce, and an eye towards families and ensuring that families can engage in this market and find the care that meets their needs. So that we get to a place that I think would be more socially optimal in terms of what kids experience and what families can rely on. So those are some of the current efforts and kind of where I see the conversation going. But I will say that evidence has informed every step of that process, both sort of very timely, high frequency evidence on what is happening in the workforce and what is taking place in childcare as an industry, and also the large body of evidence that researchers have developed over time about what works in this space. And so where should we be investing and trying to target investments?
Thank you, Chloe. Justin, what does the future hold for some of the state and local initiatives you've seen around the country?
Yeah, sure. So I'll start by echoing something that Chloe mentioned, which is sort of the innovation and a lot of different things people are trying and across different states and localities. I think that's been really exciting from a momentum perspective, but also just, seeing what else can we learn, and also in a way that is trying out and learning the best about how we can do to support childcare workers. I think on the it's exciting to see those, and I think in particular the attention not just to sort of doing those things, and I think they're especially as we sort of lean off the pandemic and funds have to sort of shift towards different sustainability sources. I think it's helpful that people are also thinking about maybe what we can learn about and how we can continue that momentum. And so I think all of that is encouraging. I think it's exciting that people are thinking about not just sort of like impacts on outcomes that we might talk about often, like turnover, but also really thinking about holistically, what is it doing for childcare workers and their experiences? I think Jessica talked a lot about this, right? We might miss things by focusing on specific outcomes, but by making it relevant to providers, we might learn about different aspects of their job or different mechanisms for how things our states and localities or initiatives are working. I think one other thing I would mention is sort of learning a lot more about implementation. I think on the one hand, earlier I talked about places like DC, which passed some really sweeping innovations, but on the other hand, not all cities, let alone ruralities and other localities can sort of do everything that other states can do. And so learning sort of not just sort of like, is something working, but the conditions in which things are working and sort of how that translates to different communities and different state governments that are trying to innovate, and learning about what can work, what cannot work. I think Chloe updates are encouraging in the sense that, as we sort of are in this moment of thinking about the future, a lot of the questions are sort of, how do we take sort of these programs, some of which maybe are intentionally short-term, some of which have a goal of being long-term. How can we sort of ensure that we're not sort of just addressing this problem in the short-term, but having to take everything back versus being able to sort of allow something to happen and really impact lives moving forward. And so I think evidence, as Chloe said, is one way in which we can sort of help continue the conversation, not just on the financing part, but also on sort of justifying, making the case, really making that movement go forward on why these investments in the childcare system are really needed. And I think moving forward, it's encouraging that the momentum thus far has allowed us to learn some things, but hopefully you can continue to keep that conversation going.
Thank you, Justin. And Jessica, I'll give you the final word on that. Does that resonate with you in terms of your view of the future of King County's work and the county government's role in advancing childcare solutions? I'm thinking about the sustainability in particular. You all are using local funding to really to do this work, but what would you say, does the future look like in particular, and who else needs to be at the table, whether it's state and federal support? And I'm also thinking about employers and, private funders. What role can they also play in supporting sustainability and a future vision for childcare?
So like how to fix it. Basically. Well, I'll be honest, I think this is the crux of what we're all trying to do, right? I vacillate between extreme optimism and hopefulness for the momentum that I see and feel on a daily basis around this issue, and absolute terror as I sit in conversations with both families and providers who tell me they don't know how much longer they can make it. And so I do think it is really important that we hold the urgency of this moment, particularly coming out of the emergency state of COVID, which really exacerbated every single systemic issue that had plagued childcare for decades. I want to say that I think realistically, we know we can't be the sustainable solution to fixing this sector. It really has to be done at a national level. That doesn't mean that there's not a really critical role for state and local jurisdictions to play. There absolutely is. And we've been really excited to see some pretty incredible legislation and investments at our state level that expand access to subsidies, that increase reimbursement rates, really trying to move towards what it looks like to reimburse providers at the full cost of care. This year, we saw legislation that directed our State Department not to consider immigration status, which opens access, hopefully, for more families. Increasing eligibility. So we're seeing some really incredible movement. Our state's also looking at trying to develop an implementation plan for what it would look like as a state, to think about capping families' costs and ensuring that providers are paid thriving wages with benefits. I think that plan could be a really important tool in our toolkit as we think about what would it actually cost? What would actually we need to invest in order to do this well? And how could that serve as a model for other states and ideally for a national model? At the county, I think we have two really important roles in this space, and I would say the same is true for many local jurisdictions. The first is that we have much more flexibility than many sort of state and federal government partners do. We have the ability to be nimble with local funds, and so having the willingness to do really deep engagement work and understand from providers and families what is wanted, what is needed, and then being able to and willing to sort of take some risks and be innovative in our investments, I think can give the opportunity to model changes that then can be implemented system-wide. So I think that's one thing that's really important, is for us to think about where are the places that we have the opportunity to do those things that other jurisdictions might not, and how can we do those in alignment with the values of anti-racism, of justice, of expanding access, all of these things. The second one I think that is really important, and this one's kind of interesting, is I think it's also our job to fill gaps, right? That's part of it. We knew we couldn't be sort of the long-term sustainable solution. We also know our constituents, both providers in King County and families, are suffering and struggling to afford care and struggling to make it by on their wages as childcare providers. And so we're not going to wait for the system to get fixed to step in and do what we can now. And so those gaps may change over time. We had a lot of conversations when we thought Build Back Better might pass about what it would mean for us. And we don't feel proprietary over fixing this. We just feel like we have an opportunity to come in where there are gaps and do more. And so really what we're trying to think about is where can we sort of fit in anywhere to push towards that long-term vision, to support others. We talk a lot with other jurisdictions who are trying to build similar programming. Really anywhere that we can sort of fill in spaces to continue building that momentum, that body of evidence, and those investments is where we want to live. And I think that's a place that lots of local jurisdictions could play a really critical role, regardless of whether they have, a $200 million fund or not, is in thinking about what they can do and where they have opportunities that their state or federal government may not.
Thank you, Jessica. I'm going to pivot now to pull forward some questions that have been submitted by webinar participants. And maybe we'll piggyback on this question around the role of employers. Excuse me, this question comes from Chris Wilson, whose question is, many large employers provide childcare as a benefit for employees. And she's sure that some are providing high quality and others may not. And so are there learnings here that are transferable to other employers about options for employers responding to the needs of their workforce around childcare? I'm thinking about, as Chloe named all of the ways that the administration is signaling the importance of childcare, about the CHIPS legislation, where the opportunity for large manufacturers to apply for support from the government around CHIPS manufacturing, and the inclusion of the necessity of a childcare plan in those applications for employers seeking funding over a certain amount. And so I want to just maybe pivot that question to Chloe, and maybe Justin, you also have some thoughts here about the ways that employers can play a role in responding to the needs of their workforce.
Yes, so thank you for the question, Chris, and thank you, Alexandra, for teeing up the CHIPS and childcare piece, because I was certainly going to mention that. So it is true that that many particularly large employers think about childcare as one of the benefits that is important for recruitment and retention. And so some do it themselves, in that they provide childcare often on site for their employees. The federal government does this for a number of federal agencies, and the CHIPS bill did include provisions for large applications. That is sort of big investments in the CHIP space would require a childcare plan attendant to building and the workforce and investing in the workforce to produce chips. And so I think in that instance, we will have a number of different ways in which employers go about this, whether they provide it themselves, whether they subsidize it. But they do need to ensure that it is accessible to their employees and affordable, that it actually constitutes a real investment in providing childcare, as the guidance lays out. So in the context of that rollout, but also in the context of what is currently happening, I agree with Chris in the question that there are, again, a lot of sort of mini laboratories across the country that are doing work on this front from which we can learn. And I think it's important for us to use that sort of myriad landscape of what's happening, to learn from it and to sort of extract the policy lessons there. And I will also just sort of highlight that there is certainly, as I've sort of, I think, alluded to throughout, there is certainly a business case for investing in childcare, that it builds labor supply, it is supportive of the workforce, and down the road, it reaps returns in the form of individuals who are, as I said, more likely to complete high school, go to college, more likely to engage themselves in the workforce. So there's a business case, but I also just want to highlight that many of the challenges we spoke about throughout the webinar will not be fixed by businesses providing childcare as a benefit to their direct employees. Now, there's certainly benefits for them and for their employees to be had from doing so, but it does not remediate any of these market challenges that we've talked about more broadly. And in fact, you can imagine in some localities that it draws from the workforce that supports folks who work at employers who do not provide childcare, and so could actually have some perverse consequences for the broader childcare workforce and the broader availability of childcare. So it is a piece of this myriad landscape that we have, and it certainly makes sense. You see employers doing it because they believe the case that we've laid out here, that it matters, and our big, broad solutions to this challenge cannot be driven through relying on employers to do so.
Thank you, Chloe. I think one of the things that's notable about the CHIPS legislation is the inclusion of family friend and neighbor solutions as a possible option, as well as home-based childcare. So I just want to highlight that, I think in implicit in your question, Chris, is a question around whether or not a manufacturer is the person who understands early learning and child development well enough to really identify the best childcare options. And I think really smart in the way that the CHIPS resources are laid out for applicants are really a call for the need to use a community design process. So a process that really is informed by families themselves, as well as those in the childcare sector, but also the really comprehensive range of options that employers are encouraged to consider when thinking about supporting childcare costs, whether that be in the form of establishing on-site childcare, or for those employers who might have workforces that are more shift work and working non-traditional hours, some of these other childcare solutions like home-based childcare. So I just want to point to that as really an important consideration for other employers who might be thinking about supporting childcare solutions. The need for a community-informed design process is critical. I don't want to cut you off, Justin, if you had a comment or two about that.
No, I was mostly going to echo everything Chloe said, which is it cannot be the path forward for all the things we talked about today, although it is encouraging that employers see it as need, and that they are sort of supportive of the idea of childcare for their workers, but it can't be the solution. And we worked with Greater Way of Austin, Texas, on the topic of non-traditional hour childcare, and the idea of partnerships between employers and providers did come up as an opportunity for them to sort of think about how to make childcare more available. So maybe in some circumstances, it is an opportunity to build on either childcare access issues or supporting supply issues as a way as an opportunity to support. But I think for all the things that Chloe mentioned, it's an encouraging path, but it shouldn't be sort of the thing we rely on to address some of the issues we've talked about today.
Thank you. And I know we just have time for probably one more question. And so I want to circle back to this idea that I heard Jessica talk about, but just in a few of the communities that you highlighted also are doing this, which is really engaging with providers and families themselves in designing the solution. So I know that was a part of the work that was done in Washington, D.C. to get the wage supplement and to support some of the other programming. And I know that that's a part of King County's work. And so I'm wondering, maybe I'll start with you, Justin, if you could just talk a little bit more about the strategies you see communities using to do that. And Jessica, I'll let you give the final word on that if there's more you want to say about King County's approach.
Yeah, sure. That sounds good. So as you said, DC had sort of a process for this, and I think it involved a number of steps. They convened a workforce commission, a working commission group, and I can find the link in a second. But really engaged a lot of different people from different aspects of folks that were involved with DC, including members from DC's Office of State Superintendent of State Superintendent of Education's office. To think sort of like what would it take to sort of both sort of develop a wage or the pay equity fund in a way that sort of prioritized both the longevity, but also allowed money to get to educators sooner. And so they actually released a set of 2 reports, one to sort of provide recommendations for like how to do the first payments, and then a second one that came several months later for sort of like for the what would it look like in future years. And so all that is sort of publicly available. I think it might, if it's on OSSE's website, it's definitely in the public domain. So that's how DC is one way in which DC has sort of incorporated multiple voices in such sort of that process. And I think Jessica can speak more to what it looks like in King County, and so I'll turn it to her to talk about King County.
Yeah, I think just briefly, there are a few different mechanisms that we've been using or thinking about. We've partnered closely with a number of partners who are sort of embedded in the childcare setting. So we partner closely with our union that represents primarily family childcare workers. With them, we did a number of listening sessions with their members to understand their hopes for a wage boost project. We have a work group that's made up of folks ranging from families to home visitors to family childcare workers to center directors. And they provide really critical feedback, I think, for us in thinking about our design. But primarily, we've really been trying to engage directly with providers themselves in conversation, in listening sessions. We have partnered with a community researcher, Jillian Marshall, in our region, who's done some beautiful focus groups. And I think those are the kinds of things that we intend to continue, right? To sort of not have it be a one-time thing, but to have an ongoing relationship with the providers that we're working with, which really will give us the ability to recalibrate and respond and actually understand where we're getting it right and where we need to make changes along the way.
Well, thank you to our panel. I'm going to pitch it right back to Carrie to wrap us up.
Great. Thanks, Alexandra. It was great to have everybody here. Thank you, Alexandra, for leading such a great conversation and bringing forward your system view into this. Chloe, you're looking at the supply and the demand side, looking at those broad societal impacts, moving to build evidence on specific interventions. That was all really, really fabulous to hear. And Justin, loved hearing from you about what's happening around the country, the importance of local context, and looking to that long-term view of how we move from local to national is really great to hear. And Jessica, as always, I appreciate you so much for continuing to center workers and families, particularly those folks who we and the systems have most marginalized. You always hold that, always bring us back to that, and that's so important. And you also help us to really link those local solutions to national action. And that's really our goal in King County. Yes, we're serving the people of King County. We're doing the best we can to do that. But we also know that we want, want our work to have national impact and to build systems that work for everybody across the U.S. So thank you all. Thank you to our audience. We really appreciate you being here with us. And we'll look forward to seeing you at our next Evidence Matters event. More to come. Thanks a lot.